Welcome to Porchlight, a presentation of Porchlight VNA and home care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in the hill towns of Hampden and Hampshire counties, all in the comfort of their own home. And it is wintertime, and boy, respiratory issues are a major concern for people during these times, and also just generally the overview of healthcare is important. I have someone on the program who knows a thing or two about both of those issues, the landscape also in the Berkshires as it relates to the healthcare industry, and she is Julie Ely, who is the area marketing manager for Caregiver Homes and also a consultant for respiratory therapy. So welcome to the program. It's great to have you.
Thank you. It's good to be here.
It's fantastic to have you, and we've talked on different programs in the past, and it's interesting. The Berkshires are unique.
They are.
It is, and you're, I think, recent to the Berkshires, right?
Well, you know what?
It's a long story.
Am not,
well, tell me
of course.
that story.
I am not recent to the Berkshires because I started the first respiratory therapy program out here many years ago, and was on the board that formed and transitioned the respiratory program over to Berkshire Community College.
Interesting.
So my heart and soul is in respiratory out here.
So when was that? Because
oh, goodness gracious. It was about, it has to have been around 1974.
Okay. Okay.
Yeah.
And so that was something that Berkshire Community College had just begun at that time. And we know we love our friends at BCC because they have a nursing program there and different kinds of programs that are a feeder system to our local healthcare industry.
Absolutely. And so, again, the respiratory therapy program. So I know a number of the therapists who are in this area, and kind of fun to run into them.
It is. So, and it is, an interesting group, and we have all these people who are providing care, and it is kind of a bit of a club, so to speak, because whether you work for different organizations over the years, and sometimes people go from one to the other.
We all crisscross, so that the medical care family actually is fairly small. You would think it wouldn't be, but it is. And everybody knows everybody, so there's no hiding.
It is. It is one of those industries that are like that, and sort of you maintain those relationships even when that does happen, when a boss or someone moves on to another position somewhere else in the state or whatever. So it's interesting. Some industries are like that. This is one of those.
And this is definitely one of them. And respiratory therapists crisscross so many different lines. And many of us who have been in the field for many years at this point are consulting with different agencies because there may not be the need to have a full-time respiratory therapist on board, but elderly people especially have respiratory problems, and they crisscross with cardiac problems. And I'm fortunate because my original degree is occupational therapy, so I can mix it all up together.
Right. So you have a whole boatload of expertise to bring to the table. So, but respiratory therapy in particular, why is that important? You talked about why, during the wintertime it is in particularly an issue, and we recently had a program where we were talking about COPD. A lot of people who suffer from that as well, and Porchlight provides that service and does presentations in the community. But the idea that respiratory health is something that people have to be aware of, and we need some specialization there.
Yeah, what happens in the wintertime and in this cold weather is that people don't protect their airways. They don't protect their breathing system. So they'll go out on a very, very cold day, like the weather we're having right now. But today's a little different because it is snowing, so there's moisture in the air. But when it's very cold, it's very dry, and that dries out the nasal passages. It dries out your upper airways. And when that happens, the airways become a little more susceptible to bacteria that can get in there and start, for instance, a cold. Now, a cold is not pneumonia, and I'm always kind of stressing that, but that can start a cold.
Now, what is the difference between a cold, quote unquote, and pneumonia? I know they're different, viruses and
they're different viruses. Pneumonia can also be bacterial. It starts in the lungs, ends up in the lungs. So, can a cold evolve into pneumonia, because you think of a cold as, oh, I have a chest cold. Well, that's a warning sign. Or I have a head cold. But what happens is all those infected secretions from the cold can drain into the lungs. And if those secretions aren't cleared by coughing, they may just kind of settle there. Now you have a different problem. Now those bacteria may start to grow and cause an infection in the lungs, which in simple terms would then become a pneumonia. So if you have a cold, it's not...
It can lead to pneumonia.
It can definitely lead, yeah.
If not correctly treated, and I use that term
Yep, that's
loosely,
absolutely,
that
yeah.
not necessarily having a doctor treat it,
Right.
but being able to make sure the cold is progressing to the point where you're going through that sort of cycle, and and clearing things out and so forth. So,
and that's one of the problems with, as you were talking about COPD in the previous program, chronic obstructive pulmonary disease. It's very hard for the person who has that to clear their airways, because they can't get the air out in a good kind of push to move everything out of the lungs to the bigger airways and out. It's very hard for them. That's the obstruction.
And is there, and so, okay, so in that case, where someone is having difficulty, getting the clearing of that airway and that sort of thing, what are some of the techniques that you can do, whether as an individual or as a specialist coming in? What are some of the first things that you would, is there medication? Is there...
I'll turn you into a patient. I'll do a demonstration. All of the above.
Clear my airways.
Clear my airways. Medications, certainly. And the medication can take different forms. It can be a medication that would help to open up the airways, because if this were your airway and it gets inflamed, the actual opening can get like this, because all of this is all swollen. So you want to get that to open up again. So that's one thing. Then if the secretions are, I hope I don't, this is going to get a little technical, clinical. If those secretions get very, very thick and very sticky, it's hard to move them. Think of molasses that's in the refrigerator. It's not going anywhere. So you might need a medication to thin those secretions. So now you've got the thin secretions. Okay, now you got to get them out. And so we do teach different techniques, that's one thing that we do, to the patients about how they can get a deep breath in, which will give them then enough air volume that when they cough, they can explode that air back out again. And if you ever get stuck with that kind of situation, and I have a little one, it's like 3 quick inhales through your nose. And if you do it yourself, you'll feel your chest expand. And then cough, and it'll much more effective.
Interesting.
That's one thing.
And so that's one thing. That's one thing. What are some of the other things?
Some of the other things people don't. It's so common that people don't think about it. Tenting. If you have a cold, you're all stuffed up. You can run hot water in the sink, go over it with a towel. Towel traps the steam. And then I encourage people, breathe in through your mouth and take deep breaths, and that steam goes in, and again will help to liquefy those secretions some. Once you get those secretions moving in and out, you just feel better. And plain old tea, I'm not talking about herbal tea, just plain old tea can sometimes help opening the airways.
Now, why plain old tea as opposed to the herbal stuff?
Because
I'm not a big tea drinker, so I don't
I'm not an herbal tea drinker, but in your black tea, your Formosa long teas, there is a chemical, an element, not a chemical it's produced, but an element in that tea that actually works as an airway opener, a bronchodilator. It's a mild one, but it does work. So drinking some tea will help open those airways up. So we know that that's in what I call plain old tea. Herbal teas can be so many different things, and be a concoction of so many different kinds of herbs that it could work or not.
Yeah, and again, it's the sort of common cold that we hope we can address quickly,
Yeah.
and that sort of thing. Because if you don't, it can lead to perhaps other issues. Now, many years ago, there used to be this big thing about zinc, and that was a big thing.
Oh, I remember that.
Yeah. What are your thoughts on that? And I don't know if they're still marketing it as such, and maybe they do, because I think if you go to CVS or something, or Rite Aid, you may still see, but there's basically information that discredited it, I believe, at some point. But what are your thoughts on it?
My own thought is that if you want to think about something like that, that you really need to read, one needs to read the pros and cons, because in fact, what's right for one person isn't necessarily right for another person. And whether you're talking about medications or zinc or vitamin C or whatever, it may work great for somebody, and the next person, nothing. So again, I just would go back. I think you need to read the literature. If it works for you, then my goodness, use it. I mean, I'm a great one for Vicks Vapor Rub because it always works for me.
Right.
I think it's the best thing out there.
So that is. I mean, and so what does that do? I mean, because you're talking about breaking up a lot of this congestion and that sort of thing, and what that brings in is literally helping all that clear. And it's how does Vapor Rub work? I mean, what is it sending through your body? It's crazy stuff, right?
Well, it is. It's
wild.
It's the menthol fumes.
Yeah.
Because you would put it on your upper chest, and it's just breathing in those fumes again helps to break up the congestion. Why it works, I really don't know. I could conjecture a million different theories on it, but it works. And in fact, I became such a proponent of it when I was 12. I had pneumonia for the first time. And my pediatrician, who, they didn't have pulmonologists then, but he was an expert in this. And I remember this so clearly, it's probably the start of my respiratory career, saying, a lot of people poo-poo this, but this is to my mother, who was a nurse, you need to use Vicks Vapor Rub on her, because that's all that's going to break that up. And by God, it did, and I have used it now my entire life.
Ever since.
And it totally works for me. I mean, I don't know, you could have the same situation and have a chest cold and you really feel awful and everything's junked up in there, and you could put the Vicks Vapor Rub on, you could breathe it, and it might not do anything for you. Or you might call me on the phone, Julie, thank you.
Yeah,
this is great.
Exactly.
Yeah,
so different aspects, and everything is different for different people. So
it absolutely is. The steam thing always works, but I said
always works.
It always works.
That's the one that always works. So go to a steam, there's a steam room, or something like that. But a hot shower, maybe trying to really get that steam in there.
But breathing through the mouth is a key on that too, because if you think about the nasal passage, and who sits around thinking about the nasal passage?
You do.
I do. Yeah, I do. And when you breathe in through your nose, one of the purposes for your nose is to filter out all that stuff you don't want. Pollen, mold spores, moisture. Because when you're breathing in the steam, if you breathe it in through your nose, just try it sometime. I encourage everybody, try it sometime, see what happens. It's going to run right back out again. And especially if you have a cold. So if you breathe in through your mouth, you're bypassing all those little convolutions that make all the whatever you're breathing in.
Because you're congested there anyhow.
Yeah.
So basically you're kind of coming in from the back end.
Exactly. That's exactly what you're doing.
And pushing things through the other way. Interesting. This is
and
fascinating
actually, that brings up a whole other thing. Water. Hydrating. Because what happens, whether it's the common cold, whether it's pneumonia, whether it's some other infection that's affecting your lungs, if you're running a temperature, you're going to dehydrate. You're just going to. Your body is made to work at 98, 98.6, not at 100 or 101. You don't feel good. You have a temperature. You pick up the cold glass of water, and oh, that really feels cold, and you don't want it. So you further dehydrate. Well, when you dehydrate, you're thickening up every secretion in your body. You need to drink the water, and if you can't stand it cold, and you probably can't, let it warm up a little bit. Ginger ale, but let it get really flat.
Yeah, really
but you
flat.
need to get
You're
it
not,
really
it sounds like
flat,
you're not
you
a
know.
big ginger ale fan.
I'm not flat ginger ale,
Yeah.
no.
Yeah. I mean, what about straight
but
ginger? How does that? I mean, is there any relation there? I mean,
I don't
because
know.
the ginger ale,
The
people always
ginger
say.
ale is considered a clear liquid, and it usually doesn't upset people's stomachs, and it may be because of the ginger. But you'd want it flat.
Because when people are
it's easier
nauseous, ginger is always,
Yeah.
often is recommended.
Yeah, it is,
Yeah.
but flat because all the carbonation then can make you not feel well, and then if your stomach starts to react to that, then that affects the lungs because everything is pushing up. The body is not like, here are the lungs, here's the heart, here's the diaphragm, here's the stomach, and none of it's connected. It's all connected.
That's interesting,
Yeah.
but when you feel bad, it's right there, I mean,
Yes.
you may think, understand that it's all connected from a logical standpoint, but really it's like, that's it, and it takes up,
It
mentally
does.
and everything
Mentally,
so much.
that's it. It's my lungs, and that's it.
It is. So, looking at that, and so you help out different agencies out there with your services.
Because there are other things too that, I mean, and again, because I am so educated in this and so schooled in it and have worked with it for so many years, have a person who's, again, has lots of, and you can feel it if it's happening to you, what we call secretions in the lower part of the lungs. We'll sometimes have them, if this is a pillow, this is their head, drape over the pillow so that the secretions are draining toward the upper airways into the throat so they can then cough it out. And it's simple little things that if a nurse or an OT or PT comes and says, we're having problems with this person, I'm not sure what to do, I'll say, well, let's get together with the person, with the caregiver or whomever is working with them, and let's see where the problem is. Do they need to get to a physician right now? Can they try just a couple of simple drainage positions to move the secretions up? Do they need hydration? If that doesn't work, and I'm not saying like wait for a month, which I'm terribly guilty of doing for myself, but if it doesn't work, within a few days, 4 or 5 days, and the person's getting worse, they need to call the doctor.
Yeah, and at what point, is that the threshold to call the doctor? When you have, the congestion, a cough, and it seems to be getting worse, because again, pneumonia is something that is still life-threatening.
It is
day.
very serious and should be taken very seriously. First of all, I really believe in the pneumonia vaccines. And if people have not been vaccinated, they should. Flu vaccine, because the problem with the flu is it often goes into pneumonia, and that for an elderly person or a child can be truly life-threatening. So let's say, I have a chest cold and I feel congested, it's hard to breathe, and you're coughing. And I'm going to get clinical again, so fair warning, cough out, and what you're coughing is just clear. Okay, it's clear, okay. But now it's kind of yellow. Now it's kind of brown or green or blood-tinged. You need a doctor because the infection has really gone too far. And actually, if somebody has chronic lung disease, it's one of the things we all watch for, and I'm guessing they may have talked about it on your previous show, but with somebody with chronic lung disease, there's usually an infection going on. So we call it sputum. What they cough out is very often yellow. But when that changes, and that's one of our signals that the infection's getting worse, if that changes to green or brown tinged, you need medical intervention. Blood streaking, that's usually, with an infection, you always get some breakdown of tissue, but it's also a warning sign. This is not right. You need some help.
Right, but again, what it's indicating is that infection has gone deeper into the lung.
Deeper into the lung, that it's bigger. It's just like if you have a little cut on your hand. And you say, oh, big deal. And then a couple of days later, you look at it and went, well, that's really red. And a couple of days later, it's worse than that and really sore.
Right.
Same thing.
Then it's going in the wrong direction. It's not
Yeah.
healing. It's not.
Correct.
It's not going in the right direction. So, so good elements to think about as well, because these things are not, especially in the senior population, not to be taken lightly.
Correct. And going out in the cold weather too. I know people don't necessarily want to do this because they don't want to look funny, but there is nothing wrong with putting a scarf across your mouth and your nose, because you will humidify yourself and keep your airways from going to spasm. Cold. Think about when you shiver. Well, your airways can shiver too, really, and those go into spasm. You don't want that to happen, so take a scarf and just cover your mouth and nose with that.
And then ways, of course, we're talking about the common cold, ways to avoid the common cold. I mean, I know it's something that people talk about frequently, and I think maybe they're used to hearing it, but I don't think it's. I think it's still worthwhile to mention again that things like washing your hands.
I was just going to say, you know what the number one thing is? You're absolutely right.
Yeah.
Hand washing. And I notice a lot of the grocery stores now here have the like the Purell wipes or the non-soap wipes to use on the grocery basket. When you, really the biggest transfer of any kind of germ or virus is through the hands. And yeah, so that's the number one.
Absolutely. So it's a good practice to have as a regular basis. That it's not so much like an inconvenience. It's just a regular chain of events that you do. You go home. The first thing you should do is just wash your hands, because you've been places. When you go to eat, obviously, and that sort of thing. So and then having a lot of that Purell. I mean, it's good to have the Purell around.
I keep it in my car all the time because I'm traveling around a lot.
Exactly.
I've got it in my car, and I get in sometimes and go, gotta wash my hands, gotta do this. One of the other things, and it's very difficult to do, but if you have friends who are coming over and they have a cold, or you're supposed to have company, and they say, we're planning on coming, but I have a sore throat. You know what, I've had to do this when I was taking care of my mother, and I would say, please don't come, because I can't afford to carry that sore throat to my mother, who was 89 years old. Sore throat is an inconvenience to us, to her again. So you have to.
Of course, when you have the sore throat, that's also when it's in that stage where it's more contagious.
Absolutely.
I believe.
Yeah, actually, the most contagious just before that sore throat happens. But yeah, much more so than the coughing and the sneezing, when you're hoping that people are again using Kleenex and washing their hands.
Right.
But as hard as it may be, I think you have to take care of yourself, and you have to stand up and say, we are so anxious to see you, but I'm going to ask you to postpone your visit, because if you're not feeling well, we just can't afford that.
And there's also a certain anxiety that comes along with it.
Oh,
With someone who is sick and then goes into the situation, it's like you can't really enjoy yourself, either as the person who is ill or the people around it who know that you have a sore throat, and there's a certain anxiety there, and so forth. So it's just not worth, because nowadays we know, 30 years ago we didn't, he had a sniffle, big deal, he'll get over it. It wasn't, but we recognize that now today, and so there's the same thing goes for workplace conduct, and when you're sick, it's don't be the hero and go in, when in reality you're hurting other people by doing it. I think we're starting to get traction on that.
I think we are too, and I think it's important, because not all people who have lung disease are elderly. You have people out there who are working in the workforce, to all appearances perfectly healthy, but they may not be. People with cystic fibrosis or restrictive lung disease, which is as devastating as obstructive lung disease, but a different type. Or may be compromised health-wise some other way that you have no idea that that's so. But if they come down with your cold, for you it's a nuisance, for them it's devastating. And I think you're right, we're getting some traction on that. don't be a hero.
Yeah, changing the culture a little bit,
Yeah.
because I think, again, if it was 10, 15 years ago, most definitely, you would have been seen, oh, well, you're sick, that's no excuse not to come, toughen up, go to work.
Yeah.
But in reality, again, you don't want to pass on those terms. I mean, now it's common sense, but it's been part of our culture, that tough it out, tough it out. So.
And we start that in school. Little kids go to school. Who gets sick a whole lot? Parents of little kids, because the kids bring home everything.
Right, or teachers,
Or the
yeah, I know you have your kids, but that's what substitutes are for,
That's right.
in the classes. So as we have about a minute left, Julie, let us know how you can get in touch with you, and of course you have your other hat, with Caregiver Homes as well.
Yeah.
We didn't get to hit on that too much here on the program, but just give us a rundown.
If somebody wants to contact me and like an in-service to their staff or just to, gosh, we just need somebody to look at our procedures and so forth. My phone number, and it's my Caregiver Homes phone number, but it's 413-441-3959.
Fantastic.
And I'm happy. I love being a respiratory therapist. It's been my career, and I'm happy to share the knowledge that I have.
Fantastic. Well, Julie Ely, it's great to have you on the program, and
thank you.
Always wonderful. We've done shows in the past,
We have.
and we'll
And I
continue to
enjoy
do
it.
them in the future.
Great.
So and happy holidays to you.
And to you, and to your family, and so forth. Thank you.
Enjoy.
Yeah.
Thank you so much. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.